Most patients tilt their head back when they're administering their nasal spray medication, but that is actually the wrong way. I'm going to share with you how to correctly administer your nasal spray medication, getting the full dose properly and safely. So let's learn the correct way. Step 1, clear your nose. Grab a tissue and gently blow and clear out that mucus that's lining those nasal passages. Step 2, mix the nasal spray medication. Gently shake to mix the medicine. Step 3 applies if you're opening a new bottle of nasal spray medication. Prime the line 1 or 2 pumps. This will make sure you get a full dose of medication when you administer the nasal spray. Step 4, tilt your head forward. Step 5, open the nasal passage. Use your non-dominant hand. Pull at the fold of the nose to make sure the medication can actually get inside the nose. Most people are using nasal spray because they're congested. Step 6 is to insert and aim. Use your dominant hand regardless of which side and just make sure you've got the proper angle when you go to spray. The top of the nozzle is going to go to about the fold of the nose. Insert that nozzle. Aim for the inner corner of your eye. The medication hits the outer lining of the nostril where the medicine needs to be absorbed. Don't aim straight up. It runs down the back of your throat. Don't aim towards the middle. Won't work, can increase nosebleeds, irritation, and might affect your sense of smell. So always aiming for the inner corner of the eye. Once you have proper position, pump down and administer the spray of medication. Step 7 is to repeat on the opposite side, keeping the bottle in your dominant hand, opening the nasal passage with the non-dominant hand. Tilt, open, insert, aim towards the corner of your eye, pump down, and administer the dose of medication. Don't sniff or snort strongly. That's just going to suck that medication down the back of the throat. We want it to stay in the nasal passages so it can be absorbed and do its job. Step 8, if you feel like the medicine is going to drip out of your nasal passages, a light sniff if you need. We don't want it dripping out. A few tips once you're finished administering the nasal spray medication. Do not blow your nose or lay down for 15 minutes minimum, ideally 30, so we make sure that the medication has time to be absorbed fully. Step 9, clean the nozzle. Run the nozzle under some warm water, then grab a cloth or a tissue, wipe it off, make sure it's dry. Replace the cap and store it until your next dose is due. That's it. Follow these simple steps each time you use your nasal spray medication, and you'll ensure a proper and safe dose each time. And make sure you're getting the benefit of the medication. Comment, let me know what questions that you have. If you're a healthcare provider, save this link, create a smart phrase, and forward it to your patients in MyChart. Grab the QR code in the comments, embed it in the after visit summary. Easy education when you're short on time. I'm Mel. I'm a board certified nurse practitioner doing primary care for over 14 years, and I've taught many patients the proper way how to use nasal spray medication. I've also seen the instances of patients not knowing the proper way, dealing with side effects like nosebleeds, dryness, irritation, potentially loss of smell, and then being frustrated because they're not doing better despite using the nasal spray medication. Let's learn the correct way.